My name is Dr. Lesedinyana Odiseng. A lot of my friends call me Dr. Les. On Facebook, I'm called Tidro, which is my alter ego. I'm a specialist in sports and exercise medicine. I specialize also in occupational medicine. I'm also a principal in family medicine, so I actually have 3 specialties. Now, before talking about myself to any great extent, let me tell you how to you go and specialize in sports and exercise medicine. I'm going to leave occupational medicine aside for someone else. I'm going to leave family medicine for someone else. Now, if you want to become a sports physician, the first thing is that you do A levels or equivalent, BSc Part 1, International Baccalaureate, and then after that you make it into medical school. In the case of the United Kingdom, you go through a 5-year or 6-year training program to become a doctor. When you qualify as a doctor, you then you receive what's called provisional registration with the General Medical Council. You're not allowed to work independently, you're working under other people. Then you go through 2 years of what's called foundation year training. The TO, you go through various specialties. I mean, you can go and do general surgery, you can go and do a bit of medicine, accident emergency during that time. But you always have someone holding your hands. Now, when you finally finish that, in the United Kingdom, you cannot go and work independently either. You still have to go through further training, the shortest being family medicine. You can go if you want to do cardiology, you gotta go for further training. You want to do chest medicine called pulmonology in the United States. You go through the same process. Now, most of the times, when you want to become any of the specialty of medicines, there is a period of 2 years or 3 years or 4 years, depending on how good you are in terms of passing your examination, before you go forward, where you go into training. For sports and exercise medicine, you can do it 3 ways. This is middle grade training. The first thing you could do is what's called the acute common STEM. In this case, you do accident emergency, you do anesthesiology or anesthetics, as we call it in the United Kingdom, you do general medicine and intensive care medicine. So you must complete those 3 before you think of anything else. During that time, you are expected to pass the examination of the membership of the Royal College of Physicians, MRCP. That's one direction. The second direction you could take, you can do general medicine training at middle grade level. That means you're going to go rotate through various specialty of general medicine, or internal medicine, as some people call it. That means you're going to do cardiology, you're going to do nephrology, you can do respiratory medicine, you can do gastroenterology. So you just rotate around that. And pass a bit of accident emergency if you're lucky. Normally lasts about 2 years. The least you can do is less than 2 years. You must do at least 2 years. But sometimes people have to go to 3 years because they need once again to pass the examination of the Royal College of Physicians before they can practice any further. Now, for me, I chose the third option. That's where you train in family medicine. That means you rotate through accident emergency, pediatrics, obs and gynae, general medicine, and then you're going to have to do a year in family medicine or general practice in the United Kingdom. After those 3 years, you have completed your family medicine training to get sort of a general certificate for general practice. Now, having completed that middle grade training in any of those 3 options, now you can go forth and apply for a registrar post as a specialist registrar in sports and exercise medicine. It's going to be sort of like a 4-year training course where you're going to go through things like rehabilitation, looking after teens, public health, or sometimes it's attached to some, a football team or one of the big clubs or something like that. Through that process, you're going to take examinations, diploma in sports medicine or masters in sports medicine. And then at the end of the training, you get the fellowship of the Faculty of Sports and Exercise Medicine of the United Kingdom. Now, when you've completed all that training and you collected everything, you assessed every year to make sure you're at the par, you complete all the T's have been crossed, everything is done and all the I's have been dotted, You know, and that thing happens every year. You got what's called RITA, which is sort of you're being examined to make sure that you've done everything that you need to do. At the end of all that, having passed all the examination, you got what's called certificate for completion of specialist training. That's what it was called during my time, but now it's called completion of a certificate of specialist training. Then you are now a consultant in sports and exercise medicine. Now, what about me? How did I get into this medicine? Well, actually, it was by default. 17-year-old, you pass your examination, you don't know what to do. My friends who were a year ahead of me at GSS had been to the UK. They came back with great pictures of, Big Ben, Wembley Stadium, all the beautiful things in the United Kingdom. So I decided to go to the United Kingdom. I decided to do a subject that could actually give me away after I could choose something else after 2 years. I got a scholarship with Epsona to go and do that, my A levels. After that, I decided to come back here and try to get a scholarship to go to do civil engineering, but the government said no, so I went back to the DBS and continued my training to go to medical school and train as a physician. Qualified in University of Nottingham. After that, I did my foundation years in Lincoln and Wolverhampton, and then after that, I did general practice training or family medicine training in the North Staffordshire Hospital Group. Because I owe the BS a bond, I came back and worked for them for 3 years, and I went back to the United Kingdom for specialized training, which I did a master's degree, sports and exercise injury management at the Leeds Metropolitan University, and also was associated with the Faculty of Sports and Exercise Medicine. Qualifications I hold, well, obviously I got the Fellowship of Sports and Exercise Medicine in Ireland, intercollegiate qualification between the Royal College of Physicians in Ireland and the Royal College of Surgeons of Ireland. Also membership of the Faculty of Sports and Exercise Medicine of London and the Royal College of Surgeons of Edinburgh. And also, I said I was an occupational physician, so I got membership of the Faculty of Occupational Medicine of the Royal College of Physicians in London. So that's my training, and then I completed that. After working in the United Kingdom, getting my specialist training in 2022, during 2002, I came back I worked there for about 8 years, and then came to Botswana and worked at the Bokamoso Private Hospital Bokamoso Private Hospital as a physician, heading the rehabilitation unit. Then, after about a couple of years, 3 years, the hospital went bust, and therefore we became self-employed. Then I founded a company called, which is traded under Mosot Clinics. Mosot standing for Medical Orthopedic Sports and Occupational Clinics. That's where I'm based now. I've been working there for the past now 12 years. Now, what does a sports physician do? Essentially, what you do, a lot of people think that we are looking after elite athletes only. No, in fact, even in the United Kingdom, only 5 to 10% of your work involves elite people. So a lot of the time, you're dealing with ordinary people, be it babies, be it grown old people, weekend warriors, all that type of thing. We mainly deal with musculoskeletal problems, which are non-surgical, so you don't need an operation, so you can be treated without operations. I give people advice on exercise. If you want to become a big guy, sort of muscular, there's a specific exercise program you need to follow, so I can advise you on that. I can advise you on how to lose weight. You want to lose weight, there's specific exercise you do for that. You want to look good, there's also specific exercise to do that. Sports and exercise medicine is a multidisciplinary profession. We work with physiotherapists, trainers, coaches, sports psychologists, nutritionists, etc., etc. So it's not just one person. You work together for the common aim of making something better. Mainly, we like to do preventive medicine. We deal with doping issues, anti-doping issues, advise people on what drugs to avoid drugs. Actually, I don't like people taking drugs. Some people phone me about what they should be taking. So that's the kind of thing we actually do. We do pre-participation medical assessments to help people when they are ready to go into sport. So in terms of the treatment modalities that I use, I mainly use biogenics. Biogenics are biological compounds that have been demonstrated to be effective in the treatment of various musculoskeletal disorders. I use dextro-based prolotherapy. This is a sugar mixed with salt with local anesthetic. You inject it into the damaged ligament, it heals. Platelet-rich plasma, you take your blood, you take away the red blood cells and white blood cells. What stays behind is called platelet-rich plasma. You also inject that into a damaged area, and that it helps in healing. Hyaluronic acid, also known as Supracin or osteo something, I think they call it that in South Africa. That is something that you use in arthritis. It is sort of like forms a cushion inside your knees when you've got some early arthritis. Other modalities, I have been trained in acupuncture. That was part of my master's training in the UK. I use acupuncture cupping, extremely effective for chronic musculoskeletal problems. We do, as I said before, it's a multidisciplinary profession. I work with physiotherapists and sports psychologists. And yeah. Now, where I work is Moso Clinic. If you just Google Moso Clinics, my clinic will come through. It is on Facebook. It is on, there's a website for as well. And then maybe I could be able to help you. Thank you very much for visiting with me.